Yeah, well, thank you very much. Hopefully you can all see the presentation on the screen now. Yes, and I'd like to recognize my partner in crime on this call, Leith Greenslade, for her help in getting ORSZCA off the ground. And she'll be able to help with any questions that follow. So thank you for inviting me to present at this meeting. I'm going to introduce ORSZCA, the ORS Zinc Co-pack Alliance, and outline our plans, our achievements so far, and how we might support the work of this subgroup. So why was ORSZCA set up? And why are we working to make ORS and Zinc, or co-packaged ORS and Zinc, the go-to treatment for diarrhea? To answer these questions, we need to be aware of some of the history of ORS and Zinc treatment and the role of catalysts, the role that catalysts play in bringing about step change. It was in 2004 that the global recommendation for the treatment of diarrhea was changed to ORS and Zinc. And now, 18 years on, we have an ORS and Zinc coverage of just 15%. The target for the Global Action Plan for Pneumonia and Diarrhea, GAP-D, is 90% access to appropriate diarrhea case management by 2025. So it's very clear that business as usual is not going to get anywhere near that target. In fact, it would take probably another 75 years for us to get to 90% access to ORS and Zinc. In July 2019, WHO changed its model essential medicines list to recommend that ORS and Zinc be co-packaged. This was in response to evidence that co-packaging increases coverage of ORS and Zinc, and that co-packs available in the market are the cheapest way of providing the 2004 recommended treatment, ORS and Zinc. It is clear, though, that we need a step change in progress on ORS and Zinc coverage, as business as usual isn't working anything like quickly enough. But a step change requires a trigger or a catalyst. We believe that the co-packaging of ORS and Zinc could be that trigger. We believe that it would transform the coverage rate for ORS and Zinc, but also deliver a higher rate of progress in all other areas needed to reduce the mortality from diarrhea. So how important is ORS and Zinc in reducing diarrhea deaths? Well, some modeling done by Dr. Black and company concluded that scaling up 4 diarrhea interventions to 90% coverage could reduce global child diarrhea mortality by 74%. ORS and Zinc alone could reduce child deaths by 50%, with rotavirus vaccine coverage at 90%, off adding another 9% to that total. So how does this relate to the GAP-D target? The GAP-D target is to have less than 1 diarrhea death per 1,000 deaths by 2025. That equates to less than 140,000 deaths in 2025, or a reduction of 360,000 on today's annual mortality of about 500,000. At 90% coverage of ORS and Zinc alone could deliver 250,000 of these lives saved, which is nearly 3/4 of the GAP-D target. It is recognized that ORS and Zinc coverage is highly cost effective and more feasible to scale up in the short term than other very important interventions such as nutrition and wash. It could therefore act as a catalyst for step change in progress that is needed to set us on a new trajectory on our mission to eliminate avoidable deaths from diarrhea as quickly as possible. So although ORSZCA's focus is on co-packaged ORS and Zinc, we are clear that an integrated approach is required, rotavirus vaccine, more hand washing, exclusive breastfeeding, to mention just three. However, we believe that a focus on the new co-packaging recommendation could re-energize efforts in all these other areas. So what has ORSZCA achieved so far? Well, we've supported the Global Financing Facility. It's specifically its Reclaim the Gains initiative to move from supporting 458 million new diarrhea treatments with ORS only to doing those treatments with ORS and Zinc. We've encouraged and supported UNICEF's supply division to correct the anomaly in their catalogue, where prices for co-packaged ORS and Zinc are more than twice the price of ORS and Zinc bought separately. This goes against what we see elsewhere in the market. UNICEF are now retendering for ORS and Zinc products for the first time since 2015, which we're obviously very pleased about. And we've established working relationships with key players in global health, including the Child Health Taskforce and in this subgroup. Our members and supporters are building a unique data set on the current status of ORS and Zinc around the world. It's very difficult at the moment to ask the question, well, how prevalent or how embedded is co-packaging, because no one really knows. And this is a work in progress, and the data set is being built in real time based on questionnaires we're getting back from members and supporters. And we'd really like your help with this. So if there's one thing we'd like you to do following this meeting, we'd like to go to the ORSZCA website and respond to this call to action and complete, either in English or French, the information on ORS and Zinc status in your country. The questionnaire takes about 10 minutes to complete. There's lots of cop-outs, so it's designed to capture the knowledge you have at your fingertips. And we're filling in the gaps by receiving multiple questionnaires from each country. So finally, how might ORSZCA and the Commodities subgroup work together? Well, firstly, a quick look at our work plan shows that we are very closely aligned. And with ORSZCA focusing on a single commodity, we will be able to deliver real progress on ORS and Zinc coverage for the Commodities subgroup. And we look forward to working together with you on this. Thank you very much. Happy to take any questions.
Thank you, Simon, for that presentation. So we would like to know if there are questions or comments relating to the presentation by the ORS Zinc Co-pack Alliance. Please just either come on the mic or type it in the chat box if you have any clarifications or comments on Simon's presentation. But Simon, let me ask this. The questionnaire you shared, how much response have you received? And do you have specific countries in mind where you still need additional responses?
Yes, we've received about 50 questionnaires so far, and the way they're distributed across countries can be seen on the ORSZCA website. We have particular gaps in the French-speaking countries. I think there are 4 or 5 French-speaking countries in the top 10 high-burden countries, and we've only so far received a response from one of them, and that was the DRC. So we're particularly interested in those countries, but we're also interested in, well, for any country basically, because the more questionnaires we get, the more confidence we can have in the robustness of the data. And you'll see, for example, we've had 5 questionnaires in from Nigeria, which obviously is the top country for diarrhea deaths in the world. And interestingly, of those 5, 3 thought that ORS and Zinc was not on, or co-packaged ORS and Zinc was not on the Nigerian essential medicines list, whereas in fact it is. So there's a massive amount of work to do in terms of raising awareness, even across the world, but also within countries, so that people are aware of the current situation, the current environment they're actually working in.
Simon, how long does it take to complete the questionnaire from your own estimation?
Well, from what people have said to us, it takes less than 10 minutes. And as I said in the presentation, it's designed to quickly capture what you know. Very few people have a complete picture of the situation in their own country. So you can just say that you don't know. You can contact us later through the comments on the actual data set itself. But we're filling in the gaps by, as I said, by getting multiple questionnaires submitted from each country.
Simon, I would like to suggest if you can put the link to the questionnaire in the chat box. And for anyone from any of the focus countries, if you have not responded, I think you may take the opportunity to provide the response so as to enrich the discourse. I think, like Simon said, even if we've received responses from your country, additional responses will still be valuable. But if you had responded in the past, you don't need to. But if you have not, and you are from any of those focus countries, please try and provide responses to the questionnaire. We want to have a very, very rich source of information here.